Good afternoon, or I guess parts of the country, good morning. This is Josh Stone with PolicyStat. We are getting ready to get started, probably about 30, 60 seconds. So I'm just going to put us on mute for a moment, and then we'll get rolling. Thank you. All right. Well, again, this is Josh Stone with PolicyStat. I appreciate everybody coming together today. We have a great group of attendees, a pretty diverse group from all sides of the healthcare spectrum. So I will not spend a lot of time talking on the front end. Jamie, if you want to go ahead and just move forward one slide. This is how to succeed in your next Joint Commission survey. So PolicyStat is hosting this. Again, at the very end of our time together, as you all are probably expecting, I'll take just a couple minutes to kind of mention who we are and the piece that we fit in with the whole scheme of Joint Commission surveys. But this is being recorded, so I want to jump to our presenter pretty soon on the front end. And Jamie's going to walk through, she's done her homework, of a lot of tips and things to consider whenever you go through the Joint Commission survey process. Definitely can be daunting. Our goal is for a lot of these points to be good reminders or things that you need to consider, think about, and you haven't in a while. And oh my goodness, thanks for the reminder because it's coming up next week perchance. So one other piece to fold in, you can certainly ask questions during. We're actually going to go ahead and save those and follow up with you afterwards with those, just so we kind of keep the recording nice and concise. Also, we do have some resources of 5 essential tips for your next Joint Commission survey that's on our website that we can also pass along to you as well. But without further ado, I'm going to hand it over to Jamie.
All right, thank you, Josh. We're going to go ahead and jump in. Thanks, everybody, for joining us this afternoon. Anybody who has been involved in preparing for a Joint Commission survey understands just how huge of a task it can actually be. Not only do you need to know where to find all your policies and documents, but you also need to show how you've improved since your last survey and what you're doing now to keep your patients safe. Regardless of how many moving pieces are involved in getting your organization ready for a Joint Commission survey, it's an important job because your organization really wants to be accredited. Accreditation matters. Accredited organizations are recognized for giving better quality of care. So if you pass your Joint Commission survey, you'll gain a competitive edge over your competition in that you'll be able to attract a better quality of staff and reduce risk for your patients. The community will have more confidence in your organization, so you'll see more referrals. Accreditation may reduce your liability insurance costs and give you eligibility for insurance reimbursement and for participation in managed care plans or contract bidding. Bottom line, passing your next Joint Commission survey is key for your organization's success. And clearly I know that I'm preaching to the choir here because you've all joined us this afternoon and are interested. As a healthcare organization seeking or maintaining accreditation, you are dedicated to continuous improvement and the best possible patient care. By the same token, the Joint Commission's mission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. When it comes down to it, you and the Joint Commission want the same thing. You're partners in reaching your mission. So look at your relationship as mutually beneficial. Surveyors from the Joint Commission mostly arrive unannounced, so make sure your front desk staff is pleasant and attentive to everyone. On the day of your survey, the surveyor generally arrives between 7:30 and 7:45 a.m. unless your organization opens at a later time. That means you need to make sure you kick off each morning with a happy staff. Put your best foot forward to get your survey off to a good start. If you have too many cooks in the kitchen, some ingredients may be left out. So that nothing falls through the cracks during your survey, choose a knowledgeable staff member as your data contact for the Joint Commission surveyor. The surveyor will go much more quickly if you're able to easily retrieve and print the requested documents, and having one person be responsible for knowing where to find those policies will streamline the process. You further streamline the survey if you create a base station with all the essentials. At a minimum, have a well-lit, designated area with a desk or a table and chair, electrical outlets, a phone, and internet access for the surveyor. Think back to previous surveys to anything the surveyor asked for during the process. If anything comes to mind, add it to your station. Throughout the survey process, be careful with your words. If you don't know an answer, don't guess or make one up. Instead, let them know you know where you can find the answer. Be concise and don't use unsure language like, I think we're supposed to, or on my shift, we. Never argue with surveyors, even if you think they are wrong. You want to follow Joint Commission standards and regulations as a matter of standard operating procedure. Use your knowledge of those standards that apply when you review your policies and procedures so you can make sure your processes incorporate standards requirements. That said, don't copy and paste the standards. It's possible that not all of the information in the Joint Commission standards is relevant to your organization. Make sure you only include the parts that do apply to you when you write your policies and procedures. Otherwise, you unnecessarily complicate your documents, when instead you should word them to be as simple and plain as possible so they're easy to understand. When you write your policies and procedures, be sure to write them realistically, not ideally. Organizations are oftentimes cited for not following their own policies and procedures. Instead of coming up with what you think is an ideal process, find out how all the processes are implemented in the healthcare setting so your policies and procedures match what actually goes on. Next, be consistent with your formatting. Staff members should not only be able to easily locate the policy, but they also need to know what section of the document contains the information they need. This can be as simple as dividing each document into sections to make them easy to sift through. For example, use labeled sections policy, purpose, persons affected, responsibilities, procedures, and definitions. A final word on your policies and procedures. Make them easy to find. Use a searchable policy and procedure management software for easy access. Look for policy management software with automated periodic review reminders, approval routing, integrated collaboration, electronic signatures, and powerful reporting tools to help you keep policies up to date and to help you maintain compliance. Each year, the Joint Commission reports on the most frequent compliance standard issues, and often the same problems appear on the list from one year to the next. Don't repeat the past. Dig up your last few audits to make sure your organization has maintained corrective actions from previous citations. First, determine previous compliance issues. What risks or threats were involved? Next, identify the scope of compliance. Who is affected by the standard? Then determine how compliance was met after the citation. What procedures and controls were put in place to minimize the risk to patients, visitors, and staff. Now you're ready to audit your current compliance. Are the procedures and controls still being followed? Could they be improved? Perform a root cause analysis, a scientific quality improvement method used for action-oriented learning. Test your improvements by planning, implementing the plan, observing the results, and acting on what is learned. Then you need to determine a course of action for negative findings. Devise and implement a corrective plan and recheck compliance. Instead of trying to cram for a survey, focus on daily continuous improvement. Spending an extra 5 minutes ensuring standards are met today can save days of time spent correcting errors later. Give your staff tools to help them check their own standards, knowledge, and compliance. To help your staff memorize key standards information, gently remind them with visual cues. Place the cues on staff badges, post them in hallways and behind desks, and make sure your staff understands and can provide examples of how the organization meets the Joint Commission standards. Note that you need to be sure postings are controlled and meet the requirements of all your accrediting agencies. Next, encourage good habits by implementing a daily checklist of common survey items. That way, your staff does daily housekeeping as a matter of course rather than as special circumstances. Start with the Joint Commission's Continual Survey Readiness document and create one that is specific to your organization. You can find the most recent version of that document, updated in February of this year, on the Joint Commission's website. Finally, as you promote daily continuous improvement with your staff, be sure to communicate in several manners. People learn in different ways, so provide a number of communications to help staff work on standards. You could start sending a weekly newsletter, a daily email or instant message, or even games like your own version of Jeopardy or Trivial Pursuit. The Joint Commission got rid of the A and C categories of the scoring methodology in favor of the Survey Analysis for Evaluating Risk, or the SAFER matrix. The new method plots the degree of likelihood to harm a patient, visitor, or staff along with the range of its scope. The purpose of the SAFER scoring method is to more accurately depict the significance of compliance issues and make it easier for organizations to prioritize their areas needing improvement. Practice using the new matrix with mock tracers so you can get used to the new method. First, plot your observations. Start with an applicable standard. Observe the environment, staff, and patients, and plot all non-compliance issues on the SAFER matrix. Then, repeat the process with the next standard. Plot the standards where compliance issues arose. Take all the standards where you found problems and place them on the matrix in all relevant areas. Next, analyze the results. Looking at the grid, look for trends that apply to the same standards. Chances are you can find even more non-compliance issues relating to these standards. Then take action. Prioritize your non-compliance areas in order of the highest risk, most widespread, down to the lowest risk, limited scope. Looking at the chart, tackle the red sections first. Move from there to the darker orange, the lighter yellow-orange, and finally the bright yellow. Remember to document everything. Keeping the records of these efforts will show surveyors that you are working hard to meet compliance standards. For more detailed information on survey and post-survey implications, see the Joint Commission slide deck on the SAFER matrix. So to recap, first, you want to appoint one person to be the Joint Commission surveyor's data contact to streamline the process. That person should be pleasant, should be confident, and should know where to find any information the surveyor might need. Second, write your policies and procedures with an eye to applicable Joint Commission standards and review to make sure they are realistic, consistent, and easily searchable. Third, review your previous compliance issues and audit your current compliance to make sure procedures and controls are still being followed. Fourth, help your staff memorize standards information with visual cues and checklists for daily continuous improvement. Last, practice using the SAFER matrix to find non-compliance areas and take action, always documenting your efforts. Finally, know that the Joint Commission is not expecting a perfect survey. Let them provide you with guidance, and your patients, staff, and organization will reap the benefits. Best of luck on your next survey.
Great. Well, thank you, Jamie. As I kind of alluded to in the front end, we tried to make this a really dense, a really rich session so you could go back on it, review it, pause, listen back. My goal right now is to kind of show a little bit about PolicyStat. So as she mentioned earlier, we're kind of preaching to the choir on some of these topics, but hopefully they're good reminders. And we certainly respect that in the whole scheme of a Joint Commission survey, policies and procedures are a small component. Definitely not the only component, but it is an important component. So if you could hand me the presenter role, there are a couple of items that I think some of you may be really interested in taking a look at. one of the pieces was talking about policies and procedures and the ability to keep track of them, stay up to date with them, and so on. Well, one of the pieces worth sharing is we here at PolicyStat have a tool for managing policies and procedures, and this is one of our clients. And I bring up this data point just to drive home that guess what they had right here? They had a survey that was coming up in February of 2013. What happened was they were scrambling. They had just installed PolicyStat recently, but they still hadn't instituted a lot of the better processes for managing these documents. So really what they were doing was the older style of scrambling to keep track of, update all of their documents in one fell swoop at one time. And because we're keeping metrics, there was a ton of searching for documents. There were a lot of folks that were logging in to work on their documents. What ends up happening after you get into a policy and procedure management tool is that ends up leveling out. I'm talking to a lot of folks who, when you work on policies and procedures, that is probably not the highlight of your day. You're probably not going home to your spouse saying, you know what I did today? I worked on policies and procedures. Well, I tried to put the scope of this wide enough to see that in the future, it is a more level, a much more purposeful processing piece, which actually allows them to, in turn, make sure that they're writing good content, make sure that they're adding the directives more appropriately, rather than the scramble everybody's logging in to make sure they can just keep up with what they need to do. And this is what we see a lot of times if they have not instituted better processes, and then our tool helps them begin to implement those. How does it do that? So just at a very high level, I won't bore you with a ton of slides here. This is a web-based application I'm just going to give a high-level overview of. Work on a mobile device. We do focus on the healthcare industry. Our customer base is about 98% healthcare clients, including about 1,200 hospitals and health systems. Looking at the attendee list today, some of you are actually clients of ours. And I'll skip some of the other bullet points just in the interest of time. So what this application allows you to do is, one of the pieces Jamie talked about is your staff know where to go to get to policies, which a lot of you probably are in that case now. But sometimes what you're missing is, are they able to find them, and you know that they are always finding the latest version and the correct latest version. So a staff member would be able to come in and literally every character as they type it in is going to pull up every word of every document. Look through it all. In my case, I was asked to look up the security and safety plan, so then they would be able to find it. You're going to see your facility's logo on it, the important dates with it, whatever your content may be would be stored in here. You could have links to related information. You could have attachments, and then I'll see my electronic signatures at the bottom. So this is what your frontline staff, and even you yourself, if you need to get to a piece of information, you're going to find it, and your frontline staff would only find the latest versions. You eliminate the risk of them pulling up an old policy. From a managerial point of view, again, this was touched on in the presentation, you're going to have reminders and reports. Okay, what documents are at my step of the approval process awaiting my electronic signature so that we can process it and have it ready and posted? What documents are coming up? This is the piece that I was kind of touching on where this can become leveled out should you want it to, so that I can see, okay, I have 4 that are past the date we should have looked at them. These are my top priority. I have some coming up in the next 30 days, 60, and 90 days. And this can all be revised and changed, again, to even out your workload so you don't spend the whole week scrambling on policies. And of course, inside the tool here is where you do the editing. It'll track everything in here. You can keep everything consistent. If you want every document that you have with these particular sections, then any new document I create, we can set up templates to make sure it starts from that. Again, all of the red lines are being tracked. So if you ever needed to go back and see what was changed when, everything is stored in here. Most organizations that we talk to are using like a shared drive or a SharePoint system, and there is a lot of time and energy spent trying to do what a software will do for you. So I can zoom in on a given window, see what happened when, and then scroll down and see whatever the red lines were for this particular document. The goal here is it's going to go through the approval process. In my case, I'm the last step. When I hit approve, the effective date will kick in. Sometimes you need it to be immediate, sometimes you need it to be in the future, and either option would be there. Lastly, I know that some surveyors really want to know, show me the past version of your document. So we definitely store all of that to where leadership would be able to see past versions. Again, a frontline nurse, a staff member, a tech would not be able to see past versions. They would only see this active one. But a manager could say, all right, here's what it was on a given date. And then we've also had surveyors, facilities tell us that surveyors will come in and say, I need to see your policy library. And then I get asked in my role, hey Josh, how do I make sure that they have access to it? Well, one of the pieces here is this read-only access link that you could provide a surveyor during the survey window and then revoke it later. That means you don't have to print off 1,000 policies and give them a hard binder. Some of them will say that's required, and I'm yet to find where that is. A lot of times what we hear is they just like it to take back to their hotel room to read over that evening. Well, you can go paperless, save yourself a lot of time and energy, and just give them read-only access for that narrow window. And they may also want some reports. One of them that we're asked about is, hey, what's your current policy library? What's different from last time I was here, and why is it different? Well, that why piece is really important and really tough to track until we built this report, largely driven by customer feedback that said, you know what, why don't you require a comment that allows us to summarize what the changes were? So in the tool, as you're making certain revisions to document, it requires it. Because if you think about the red line aspect, I can insert the word no into a policy and it changes its whole meaning. But from a red line point of view, it's 2 characters. Other times, and what Jamie alluded to, you want to make sure the policy is very readable. You don't want to write it for somebody with a PhD or an MD when it might be a tech that's reading it, who may be fresh out of college or just fresh out of high school, and you used a lot of language that he or she may not be familiar with. So you definitely will have some technical jargon in there that your staff will know, but you want to write it for your audience. And sometimes that includes rewriting an entire policy, even though it says the same thing. So when a surveyor comes in and says, what did you change to this policy? Oh my gosh, there's tons of changes to it. But other times you just want to say, you know what, we updated some format, we revised the wording to be more clear. But this full report is in here that you can download and provide to a surveyor as needed. Some of you are probably noticing this no comment provided because we don't require a comment if it's new. The whole darn thing's new. Go ahead and take a peek at it. Definitely a PDF backup is in here. I know I referenced being able to being able to provide the Joint Commission surveyor a read-only access link. If you say, you know what, I really still want to print off the whole darn thing, then you certainly can as well. This is just a really high-level overview of what this tool provides. You could also use it for acknowledgments and some other pieces. My goal today is not to give you a robust demo, but just to let you know that these tools are out here, and if you've never taken a look at them, we're happy to set up a time to do so for you to review it. With that, I think that is the last of our slides, correct? So again, we try to keep this clear and concise, squeeze it within a half an hour. We know that you all are staying very busy, so really appreciate your time. We will hang on the line for a little bit if there were supplemental questions or requests that you may have. Go ahead and type those in the chat window, or there's a question window of the webinar, GoToWebinar box. But otherwise, verbally and audially, we are going to sign off, and we really appreciate everybody's time today. Thank you so much.